It's cold in here, isn't it? So good afternoon. Today we're going to be talking about our ongoing COVID-19 testing efforts and a new initiative to improve access to testing in communities that need it most. But first I want to provide my daily update on COVID-19 metrics. Yesterday the state reported over 7,200 new individual tests for COVID-19, and in total we've now done about 1.1 million tests across the Commonwealth. Yesterday there were 140 new positive cases to report. That brings the statewide total of positive cases to 104,799. The 7-day average for positive tests remains at about 1.9%. That's the number it's hovered at, a little bit below 2% for the past few weeks. The positive test rate has dropped by 93% since the middle of April. There are currently 621 patients hospitalized for COVID-19 in Massachusetts, and around 100 of those are in the ICU. Those numbers have been pretty constant for the past several days. The 3-day average number of patients in the hospital is down by 83% since the middle of April, and as of yesterday there were 5 hospitals using surge capacity, although I think most of those were not related to COVID. Overall, the public health data continues to show a downward trend on many of the key metrics, and the progress we've had there is enabling Massachusetts to reopen on a phased basis while continuing to contain COVID. With respect to today's announcement on testing, I think as everybody knows, testing is one of the critical tools in the toolbox that we use as we continue to fight and contain COVID. It helps us identify where the virus is present and allows us to trace and isolate positive cases in a targeted way. Testing will remain a crucial tool in the months ahead. Last month, we submitted a comprehensive plan to access federal resources that could support continued and expanded testing here in Massachusetts. The plan focuses on boosting our testing capacity and providing on-demand access to testing for symptomatic individuals and their close contacts. This strategy is crucial to containing the virus even as we reopen the economy so that we can monitor exactly where new outbreaks occur so that they can be traced and contained. The plan we filed last month also prioritized increased testing for vulnerable and high-risk communities, nursing homes, folks in the 24/7 care delivery business for folks with developmental disability and mental health issues, and emergency response providers. We've made a lot of progress in fighting COVID-19, and today, as I said before, that 7-day positive test average stands at about 1.9%. However, not all communities have experienced that same rate of decline with respect to the prevalence of COVID. And that's why today we're announcing a Stop the Spread testing initiative, which will begin on Friday, July 10th, and run for the next 4 or 5 weeks. No one needs to rush to any of these test sites. They're going to be open and available to people, as I said, through the middle of August. We're launching this program in 8 specific communities where the prevalence of COVID-19 is above the statewide average and where we've seen a decrease in testing volume since April. The goal of this initiative is to provide widespread asymptomatic testing in an easy-to-access location within these communities. Increased testing within these communities will help to identify new cases of COVID-19 and help stop community transmission. It will also provide people with a certain sense of comfort if they do believe that they may have been exposed or otherwise believe they need to be tested. The 8 municipalities selected for these free testing sites show the most specific need at this point in time based on 4 metrics. We analyzed data from all 351 cities and towns, looking for areas that had elevated total spread, elevated spread over the past 2 weeks, high positive test rates for the past 2 weeks, and declining test volume since the end of April. This initiative will be launched at the end of this week in Chelsea, Everett, Fall River, Lawrence, Lowell, Lynn, Marlborough, and New Bedford. The testing initiative, as I said, will run for 4 or 5 weeks in these locations, and we urge people in these communities to take advantage of the availability of these test sites, even if they don't have symptoms. Collectively, these communities make up approximately 9% of the Massachusetts population, but have seen 27% of the Commonwealth's positive tests in the past 2 weeks. The statewide positive test rate over the past 2 weeks, as I said before, is a little under 2%, but in these 8 communities, 8% of the tests there have been positive. That includes some individuals who've had multiple positive tests. Despite the continued elevated spread in these communities, total testing in these communities has actually declined by about 40% since the end of April. By boosting testing in these communities, we can more effectively drive contact tracing efforts and support there. This will enable people who test positive to appropriately isolate with supports. It will give them somebody they can talk to about how to manage their time during this period, and it will also help us trace their close contacts and encourage those folks to get tested and to then isolate if they test positive with supports as well. As I said, the initiative will run for the next 4 or 5 weeks, which is basically going to run through the middle of August. During this time, we'll continue to monitor the data closely to evaluate the impact of this initiative, and we'll also continue to closely monitor other communities. If there's evidence of an increase of positive tests in other communities, we'll look into expanding this initiative to those communities as well. Residents of these 8 communities can visit mass.gov/stopthespread to find out where testing in their communities will be available. Some locations will be in brick and mortar sites, and others will be mobile vans that will be located at various sites throughout those communities during the week. We'll be advertising this information in 6 different languages to help get the word out across these communities. We're hopeful that this new effort will build on our strong commitment to sustaining Massachusetts' role as a national leader in COVID-19 testing. We look forward to seeing how this program will support people in these communities that continue to be hit hard by the virus, and anticipate that that knowledge can be used to help them, to help their healthcare community, and to help municipal leaders in those communities as we all work together to continue to contain and fight the virus. And with that, I'll turn it over to Secretary Sudders.
Governor, Lieutenant Governor, good afternoon. As the Governor said, it's important that everyone in these 8 communities take advantage of the free testing to help stop the spread of the virus. Getting tested is a loving gesture. It protects your family, friends, and neighbors from COVID-19. As a reminder, if you test positive, you should self-isolate and limit your contact with others. Limiting contact with others is key to stopping the spread of the virus. We know that self-isolating at home can be difficult for many people. So the Commonwealth established isolation and recovery programs so that individuals diagnosed with COVID-19 have a safe place to go. To date, almost 500 individuals have been served by our state-contracted locations. We have kept 2 isolation recovery programs open, one in the western part of the state and one in the eastern part of the state, Northampton and Everett to be specific. They're available at no cost, and we arrange the transportation to and from the programs once you've recovered. If you are in need, please call 617-367-5150 to access one of our isolation recovery programs. We strongly encourage you to take advantage of the resource if you cannot safely isolate yourself from your loved ones at home, because it's important for individuals who test positive to have the ability to isolate themselves while in recovery to stop the spread. We're also reminding residents that if they test positive for COVID-19, please answer the call when you're contacted by the Contact Tracing Collaborative or your local Board of Health. Answering the call and sharing information about your close contacts helps us track the spread of the virus and keeps us all safe. Remember, it's incumbent upon all of us to stop the spread. Governor?
Questions on this?
Governor, the President is demanding schools reopen in person in the fall and threatening to withhold federal aid if they don't. Are you concerned about that?
Well, first of all, I don't think a one-size-fits-all policy on any of these issues makes a lot of sense. What we've done here in Massachusetts is work closely with our colleagues in the healthcare community, the pediatric community, and the education community to put together a program that's based on this idea that we would like to see kids return to school. But as part of that, DESE is also expecting schools to develop programs that would work on either a hybrid basis or a remote basis, depending upon what happens. And I think most of all, one of the things we've tried to do is to create some frameworks for people around how to think about this issue, because this is July, we're talking about September and beyond, and I think it's inappropriate for the feds to think about this as a one-size-fits-all. I think what they ought to be doing is working with folks like us and others to come up with strategies that ensure that they and we can work together to ensure that schools have the resources they need to be able to open. And I'll give you a good example of that. When we announced our proposal, what was it, 2 weeks ago now? Whenever we announced our proposal, we talked about the fact that we had about over $900 million in resources, most of which was federal, that was available to support communities and school districts as they went through the process of figuring out how to develop these plans. I think that's a much more effective way for the feds to play in this space than put a one-size-fits-all or an ultimatum in place. Because facts on the ground are going to be different depending upon where you are, and the goal here ought to be to provide the kind of supports that the feds believe would make it most likely for school districts and for communities to succeed in reopening their schools.
How many school districts, just a quick follow-up, how many school districts have submitted their plans?
They're not due for another week or so.
Have any submitted them?
We're fully expecting that they will be landing more or less on the date that they're due, like every term paper every one of us ever wrote for any class.
On the topic that you were talking about, the testing, the reopening, is there a talk of changing the strategy for those 8 communities if things continue to, you know what I mean?
Can you ask me, be a little more?
Would you consider adjusting the strategy for the reopening in those communities to mitigate some of the testing?
Well, it would depend a lot on what the testing data said. I mean, first of all, many of those communities that are currently at 8% were at 40% in April. I mean, there's been significant progress made across the Commonwealth. These communities represent places where we have seen not only a test rate that's higher than the statewide rate, but also a drop in testing generally. Part of what we'd like to do here is encourage these communities and the folks in these communities to come out and get tested, because they have a higher rate of testing positive generally than we've seen in the rest of the Commonwealth. But the strategy for dealing with the results on that will depend a lot on what those results say. You know, you would treat a commercial property, a grocery store, a Walmart, differently than you would treat a rest home or a housing project. You would treat differently than you would treat a neighborhood. I mean, it would depend a lot on what the nature of the data showed with respect to what the response would be.
Governor, do you have any plans to adjust your reopening guidance?
Pardon me?
Do you have any plans to adjust your reopening guidance given that there's mounting evidence suggesting this virus is airborne?
I think most of the reopening guidance that we've issued has all been built around this idea that people, if they can't distance, need to wear face coverings. And a huge part of that was driven by the data that showed that when 2 people are wearing face coverings, if they're not distanced, the likelihood of spread drops dramatically. And that's not just sort of like theoretical evidence. There's now a growing body of evidence, research that supports that. And I think part of the reason why we went there in the first place was because there was a growing body of evidence that implied that aerosol spread with respect to this was real.
But you're comfortable with the indoor spaces being open right now, given that the World Health Organization is even talking about this being a threat inside?
I think we've said all along that part of the reason why our guidance in indoor spaces has been so aggressive is specifically because of concerns about that. And we've taken a lot of blowback from a lot of people about how aggressive some of our indoor guidance has been. But we felt it was appropriate given the facts as we understood them.
Going back to the ICE topic, I know you said,
Pardon me?
Going back to the ICE topic,
I think Sharman was asking about school reopening.
School, yeah, the president's.
President Trump's ICE
He's threatening to.
There's two, I think there are two issues here. I thought you were asking me about K through 12. Okay.
Okay, then on the topic of colleges, revoking visas if classes are fully online, is that something you support?
No, I said yesterday, first of all, I thought it was a premature decision given kind of the state of the facts on the ground. But more importantly, I just think federal edicts like this, especially given that the facts on the ground do change quite a bit and are different everywhere, don't make a lot of sense. And I would say the same thing with respect to higher education that I said with respect to K through 12, that what we ought to be doing is work, and what I would like to see the feds do is work with us at the state level and with the folks in higher education to come up with plans and strategies that can be supported and funded. And if you look at the particular issue you're asking about, there are a lot of those folks who are working on really important research, some of which actually relates to COVID, both here in Massachusetts and in other parts of the country. Some of our best minds are involved in that. I don't see any reason at all why we wouldn't want them to continue to do that work.
Do you think some of the edicts that are coming out of Washington are driven by politics?
What date is it anyway? I try not to speak to the intent of other people's motivations when they make proposals and issue statements and policies. I happen to think both of those are not the right answer for either the higher ed system or the K through 12 system. Say again? Yeah. I think they're one of the participants in this initiative, aren't they? They're not. Okay. So part of it will come down to whether or not they have the volume to support it.
Governor, have you had the chance to talk to the governor of Maine yet about any of those travel restrictions in place?
I did talk to Governor Mills in Maine, and Secretary Sutter's talked to her counterpart. I basically said I'll put my data in Massachusetts up against your data any day, and we had a very collegial conversation, and I think the conversation Secretary Sutter's had a lot more facts in it than the conversation that we had. What I would just say is that we have a lot of really great places to vacation, and I would encourage everybody and anybody to pursue them, and especially the folks from the states that surround us that don't have to rely on the 14-day quarantine.
Do you have any guidance for
Some of the
people who
parents,
plan on?
some of the parents were upset that they can't watch their kids play sports if they're 18 or over. And this is tournaments, I guess. Any comment? I guess the reopening is just that cuts off 18 and above. You can't expect.
I think we spent a lot of time on this, and I have 3 kids that played sports in high school, 2 that played it in college. I get how important this stuff is. I also recognize and appreciate the fact that caution with respect to COVID is, especially when you're talking about summer guidance and going back to school in the fall, is an important element in how you make these calls. But the Lieutenant Governor spent a lot of time on this.
I have. And as a mother of 2 teenagers that are athletes, this is a challenging time for them and for families and athletes across the Commonwealth, no doubt. Just to remind everyone, the guidance that was issued this week relative to youth sports is for summer. And what we've done, like we've done in the past, is looked at different levels of play as well as the actual risk associated with the sport in terms of contact and non-contact. What we added for phase 3 is that all sports, no matter what your age, can be played in terms of on the field with the distance between groups. So no matter what age, you can do that. In terms of interplay, students and athletes playing within their team, that can take place for moderate and low risk, as well as team versus team play for games, which was added as part of phase 3. So that's a big change to allow athletes to be able to compete against another team is a lot of added playtime this summer. In terms of tournaments are more complicated because now you're working with teams from other jurisdictions outside of Massachusetts, and most often involving parents that do convene socially and get together more closely. I've attended many of those over the course of my time as a parent, and we received advice from the medical advisors to limit tournaments in Massachusetts to just the lower risk sports. Now, this is step one of phase 3. We'll continue to evaluate the data and determine whether there is a step 2 that can be added this summer. And at the same time, working with the sports associations like MIAA and a medical advisory team, really think about sports for the upcoming school year. Sports are a big part of a student's development. For many students, it is an issue of accessing opportunity. We view this as an equity issue, and we want to really spend our time over the next few weeks working together to determine what fall, winter, and spring sports can look like as we get kids back to school on a more regular basis in class and sports and activities to make it as a normal experience as possible for students all across our Commonwealth.
Governor, do you think Commissioner Florio should keep his job?
We just heard about this issue about a week ago. There's an active investigation going on. Obviously, there's no tolerance for intolerance, and I'll leave it at that. But I think it's important that that this be investigated, and that investigation is going on right now.
Well, he appears to have admitted to wearing some of this stuff. And, I mean, what more do you need?
It's 30 years ago. There's a lot of work that needs to be done to follow up on some of that.
Governor, do you have any guidance for people traveling to Trump's rally in New Hampshire this weekend? Should they have to get a test when they return?
Wear a mask. Wear a face covering. I mean, we tested 16,000 people who were involved in large gatherings, primarily the demonstrations and protests that took place over about a 2-week period of time. The vast majority of the people who participated in those demonstrations and marches wore masks. And the positive test rate coming out of that, I think, was 1.27%. I mean, and I don't know how many times we need to say this, and maybe never will be enough, but this is about you, and it's also about the people you're with. And if you want to protect yourself so that you won't be somebody who carries this asymptomatically or otherwise and gives it to your family and your friends and your coworkers, that's one way to think about it. But the other way to think about it is you can carry it asymptomatically. No one disputes that anymore. I mean, I get the fact that there was a kerfuffle with the World Health Organization a few weeks ago about that, but they backtracked pretty fast based on the evidence and the knowledge and the information and the experience that came from others. A mask is a great way for you to protect others too. And if you think you're going to be in close quarters with other people, we never stepped on anybody's First Amendment rights. I want people to remember that the first marches that took place and the first rallies that took place in Massachusetts were against our reopening plan for going too slow. And no one got ticketed, nobody got fined, nobody got arrested, okay? The First Amendment piece is a really big and important deal. But I would just urge people to wear a face covering for themselves, for their families, for their friends, for whoever's there.
Governor. We've heard reports that...
Say again?
We've heard reports that the contact tracing program has been scaled back considerably. Is that the case, and if so, how does the state plan on scaling back up in the event of a surge in cases?
We had a 40% positive test rate when we started the program. We now have a 2% positive test rate, which we've had for several weeks. The number of people who need to be reached out to has dropped dramatically. And if you look at all the metrics that are out there about how many contact tracers you need to actually support a certain level of continued positive tests, we eventually just had way more people than we needed. And remember, the way this thing is set up, it's a collaborative. So, you know, the first line here, it's one database, all right, that's loaded all into the Maven system at DPH. But the first line here are the local boards of health. And if the local boards of health can handle the incoming, can get to everybody within 24 hours that they need to get to, that puts less pressure on the Partners in Health, the collaborative part of the program. And as our positive test numbers went down, it got easier for local boards of health to actually absorb and get to the people within 24 hours that they needed to get to, thereby meaning we needed fewer people on the Partners in Health side. Now, a lot of those folks are on callback, and they want to be on callback, and they basically said if the positive test rate goes up in Massachusetts, if we have a situation once again where local boards of health need to start turfing significant numbers of people who test positive to the collaborative, they have people they can bring back to serve. But I think from their point of view and ours, it didn't make sense to carry a lot of people who literally, at the current rate of positive tests we have, just didn't have that much to do.
Governor, on the 8 communities, I'm not that familiar with Marlboro, but I'm very familiar with the others. Is Marlboro an outlier in that group? Can you give any, you've read an awful lot of statistics about why, but no sort of feel about why is that happening in those communities? The other thing I wanted to know while she's looking it up is the 25,000 tests by the end of July a day. Are you still on track to do that?
We have the capacity for it. The question is whether or not people will be there. I mean, remember, when you and I first started talking about this, there were questions about whether we'd get below a 5% positive test rate by the time we got to July. And we've been running at 2% now for about 3 weeks. That does have an impact on how many people show up to get tested. Part of the goal here is to put additional testing capacity with as few barriers as possible in place where we still see, relative to that 2% number, a much higher positive test rate and a decline in the number of people who are actually showing up to get tested. I think Marlboro is there because their numbers support it.
So do you have any sense of what's going on in that community that would, the others are very urban areas, densely populated. I'm not that familiar with Marlboro, so I could be totally wrong. Maybe it's the same, but.
Why don't we see if we can get back to, I have some thoughts on that, but I don't know if I'm right or not.
None of those communities are in Western Massachusetts. Do you intend to expand that there?
If the folks in Western Massachusetts start to have issues, absolutely. I mean, Western Mass, remember, Western Mass was sort of one of the first parts of Massachusetts that actually showed significant outbreaks. And then Western Mass actually got very low enough at one point in time that I remember you asking me why we weren't opening up their economy before we opened up other people's economy. They've continued to stay very low. And I think the point I would make on this is that we picked these places because they had higher positive test percentages than other parts of Massachusetts, lower tests than they were actually getting by a significant amount back in April. And if we start to see movement in any of these places, we'll make the adjustments. That's part of what this program's about.
Thanks, everybody.
Thanks.